Jack was referred to me by his teacher because she said that he was complaining that he could not see the blackboard. I did a vision assessment and sure enough found that there was a big difference between the vision in his right eye and the vision in his left eye.
Diagnosing Jack's problem was simple. Fixing it presented a challenge. Jack's parents are students on very small stipends with no insurance.
I would like to make a referral to Healthy Learners.
16 years ago, the Sisters of Charity of St. Augustine's Providence Hospital launched the program which would become Healthy Learners. It was intended to meet exactly this need, providing vision care to children trapped in the gap between the Medicaid and private insurance systems.
They make just a little bit too much money to qualify for Medicaid, and yet they really don't have the capability of private pay or having their own private insurance.
Once Nurse Duff referred Jack, Healthy Learners underwrote all the costs. Jack's eyes were examined by a participating optometrist whose reduced fee was paid by Healthy Learners. Jack's glasses were paid for by Healthy Learners. Jack was even driven to and from his appointments by a Healthy Learners student liaison.
In the beginning, we tried to look at what children really needed, why they were falling between the cracks, and one of the major reasons was lack of transportation.
Healthy Learners solves that problem by providing transportation, safe, reliable transportation for the student from their school to their healthcare provider.
The core goal of Healthy Learners has always been empowering students to make the most of their educational opportunities. Just what Jack's now achieving.
He's doing very well. He can see the blackboard, no further complaints. He's a very bright child, and he's more willing to read now than he was before.
Healthy Learners began as a vision program, but quickly evolved to embrace a wider range of healthcare needs. Dental problems were an obvious target.
These kids come in and they may not have ever seen a dentist. You know, we have many that have maybe between the ages of 7 and 10 and never been to a dentist office. Not only do they have decay, but they may have gum problems. And that's why this program is so important, because it's the only way they're going to get any dental care.
Chronic conditions were another area where Healthy Learners could make a substantial impact.
The medication that is required for children who have chronic illness can be very, very expensive and can go far beyond what some of our parents can afford.
And clinical counseling has emerged as a critical need.
You can say if the child can't see or if the child can't hear, then they can't learn. But if a child has turmoil going on at home, or if the child is depressed, or if the child has problems with their peers, then there are difficulties that keep them from learning too.
Neil is a totally different boy from the child that he was when he first came here. He's just grown into the little boy that I've known that he could be, that he's wanted to become. He doesn't go around going, I'm stupid, I'm dumb anymore. He goes around going, I can, and it's okay.
We knew early on that Mac was having difficulties in school, and I'm talking about kindergarten, first grade, and we kept hoping he would outgrow it or get over it, and he didn't.
He was not doing well in school, needed some medicine for attention deficit disorder, was bouncing off the walls, had trouble making friends, wasn't able to complete sentences, really. It had lots of different deficits.
We're at an elementary school at A.C. Moore and had a very sharp, on-the-ball school nurse. She knew about Healthy Learners and she turned us on to them.
She knows I was an intelligent child, that I could finish my work just like that because I was doing it. But the hard part was that I could not focus in straight.
Dr. Jennings helped him fit in and to learn how to work with his disabilities and how to not so much overcome them, but to work within them and make them work for him.
I'm doing pretty good. I'm kind of struggling in one class, but I'm doing good. I've been getting more and more advanced in reading, and I'm starting to like it.
He is now on the honor roll and has lots of friends, is a leader in his scout troop, and is doing very well on the baseball team and has just made lots of successes.
Healthy Learners has expanded geographically as well.
We developed a partnership with Blue Cross Blue Shield of South Carolina, and they expressed a great interest in the expansion of Healthy Learners. And so they became the lead organization in 2005, awarding us a $500,000 gift to expand to serve more children in South Carolina.
Right now, we're serving children. We will expand and become a model program. It is our goal, it is our vision, it is our hope that we will be in every county in South Carolina.
From the beginning, the Healthy Learners staff has known that the key to success is partnership.
We recognize that this program will not be sustained in any area that we go into unless we have community buy-in.
The support of the community in the form of the advisory board that with their heart and soul they advocate for the children. With the school system, whose school nurses are our true partners in identifying the needs of the children. With parents who very much want their children to be healthy. With providers that partner with us in providing the care to the children. Our funders, our major funders.
If we get the right people around the table, we can make it happen.
What brings people to the table is a common understanding that what they're doing today bears significant fruit tomorrow.
Over the years, I have fewer and fewer students who have dental needs because basically I've taken care of them all through Healthy Learners.
Whether it's glasses or whether it's a good bill of health with teeth or medical issues, emotional issues, that you give them those tools to improve, that you're going to see a tremendous return.
Think of it as a long-term investment. If we can get these children health care, it'll improve their education, and some years later, we're going to have a better workforce.
Those are the future leaders of this state and this country, and we need to focus on giving them the best opportunity to learn the most and to get the most out of their educational system.
But whatever tomorrow may bring, today is unquestionably better for these children, like Vincent, whose life has been transformed by Healthy Learners.
We have provided vision care for Vincent. He's been to the dentist. Vincent also had a skin problem. He had a ringworm in his scalp. Vincent told us, and this sort of breaks your heart, that the children at school were calling him Patches because he had a patch on his head that wouldn't heal.
Before he was like just a little sheltered child. When you see Vincent, you'll see him playing to himself. That's the type of person he was. He didn't take too kindly to people. Since Healthy Learners, he's opened up a whole lot. He's singing. He wants to sing at every event. He's in the choir now. Only thing kids want is somebody to take time out with them that's going to understand them. And when they get that, kids glow. They just need somebody to make them shine. And that's what Healthy Learners do.
Let it shine, oh, let it shine.